Now, as the Delta variant of the coronavirus is sweeping across the world, Israel, despite its high vaccination rate, is also not immune. As the Prime Minister calls on Israelis to avoid traveling abroad and has shut down Israel's borders to tourists until August 1st. So, is Israel potentially on the verge of a fourth wave? Joining us now to discuss is Professor Nadav Davidovitch from the Department of Health Systems Management from Gurion University in the Negev. Welcome. So first things first, a bit about the Delta variant. Just how dangerous is it and how big a threat to Israel and to, the corona-free lifestyle that Israelis have already gotten used to?
The Delta variant is a threat all throughout the world, mainly because it's much more infective. The pace of its spread is about 50% higher than previous variants. And those who are within the issue of COVID are maybe not so surprised. The fact that we have vaccine nationalism in so many countries with slow vaccination rates is a fertile ground for developing new variants. This is one of them. And we see now the Delta variant already in 80 countries, including within Israel. We are lucky that the Pfizer vaccine is quite efficient. So it's serving us as a very important factor, but vaccination are not enough because all vaccines, including Pfizer, are not 100%, and there's still people that are vaccinated can transfer the virus. And this would happen now in Israel. We have two localized outbreaks, one in Binyamina, one in Modi'in. People that came back from abroad, even if vaccinated, can transmit it, especially to young students at schools because they're not vaccinated. So what we need to do now first is to speed up vaccination. We have still 200,000 people above 50 high risk that should be vaccinated, and also children, because we have now the data that the vaccine is safe and efficient, but also to do all of the surveillance needed, comply with the regulations in terms of people returning from abroad.
So let's talk about that.
To use
Yeah, let's talk about that for a second, about Ben Gurion International Airport and the travel restrictions, right? We've known the Delta variant is around and potentially dangerous for a while. So, why were we talking about reopening borders on July 1st, just a few days ago, only now to shut down Israel's borders?
Up until several days ago, the new cases, the numbers were almost zero. In the last 3-4 days, we have now about 100 cases per day. And we see the issue of the variant. And this is why we probably need to take some measures that are not going to spread the virus throughout the country. Again, this is still localized because of the high vaccination rates. Hospitals are not affected as they were during January. And probably the whole situation is part of the global situation that, unfortunately, it's a market failure that countries are not collaborating enough. There are some initiatives like COVAX that Israel participated. But I think it's a warning sign for future emergencies to arrive that we need to have global health governance.
And what about Israelis or those who are planning to travel to Israel from abroad? I mean, what advice would you give them?
You need to go to the Israeli website. There are instructions that are updated constantly. You need to do the test, PCR test, 72 hours before entering, but also to remember that the whole route before your flight, at the airport, wearing masks, during the flight, at the arrival, you need to protect yourself, and also when landing to take another test, and if coming from problematic countries, to comply with isolation. This was another problem. I'm so happy that all relevant ministries were sitting together, Ministry of Health, Ministry of Transportation, Aviation Authority, because you need to work and do an integrative approach. This was part of the problem, especially with the previous government. I also hope that we're going to solve the issue of vaccinating Palestinians, because it's also both a humanitarian but also an Israeli interest, because new variants can arrive also from there. And again, we need to have global health governance. It's not just Israel that need to take some measures, but in collaboration with other countries.
All right, Professor Nadav Davidovitch, thank you so much for taking the time to speak with us today.
Thank you.